In this video, we're going to discuss depression, mental illness, and OCD, or obsessive compulsive disorder. The consequences of these illnesses is that I would sleep 18 hours a day, I couldn't think clearly, I couldn't speak and verbalize, and my verbal communication ability was substantially impaired. I also had problems with learning new things, I could not concentrate. And regarding OCD, some of the things that I did was I had compulsive list making. I would check everything and I would constantly check to make sure that I was doing things correctly, or that something was, or that I wasn't forgetting something. And numerous times I went to Columbia University. I had cognitive behavioral therapy. I had repetitive transcranial magnetic stimulation, and I also had intravenous ketamine. So I just want to break down for you. So I've been on about 20 medications. I've also gone to Columbia, as I just talked about, for cognitive behavioral therapy, RTMS, which is repetitive transcranial magnetic stimulation. I was bilateral, and also intravenous ketamine. But I also want to discuss with you my story and exactly what happened, and the ways that I was able to mitigate some of the symptoms of the illness that I possessed, and some of the reasons why I believe I was afflicted with mental illness, and also some of the things that you can do in order to prevent yourself from having these illnesses, whether it be depression, OCD, or other mental illness, substantially impair your life to the point where you just simply can't function. Because back in 2009, that was effectively what happened to me, where I was sleeping 18 hours a day. I couldn't think clearly, I couldn't concentrate, I couldn't really do anything. I was so depressed, I essentially had no hope. So my illnesses started when I was around 15 years old in high school, and I was a junior. My father is a doctor, my uncle is a doctor, and my dad, I believe, is a really good doctor. He actually cared about his patients, and I grew up in a really small town in upstate New York. So when I started feeling this way, I couldn't understand why, because I had a really good childhood, although my dad was very psychologically abusive. But besides that, he wasn't like physically abusive or anything like that, and nobody's life is perfect. So besides my father being very mentally abusive towards me, there really weren't any red flags that would indicate that I should be someone that is afflicted with mental illness. And so I told my dad that I just wanted to go to the doctor and be placed on medication. To his credit, he was actually a little bit hesitant about placing me on medication, but I thought that all medications and that the psychiatric, the pharmaceutical industry has your best interest at heart, and I figured at that time, at only 15, that if I could just pop a pill and have all the symptoms go away, so that way I could feel and return to how I felt just a year prior, that would be fantastic. So when I was 15, I started getting angry for no reason. I started feeling like crap. I remember I would come home from school and I would just sleep for 4 or 5 hours. I just was very unhappy. So I went to the doctor and I was prescribed medication. At this time, I think I was taking Depakote, Neurontin, and a little bit of Zyprexa. Now again, this is almost 20 years ago, but Depakote, Neurontin, a little bit of Zyprexa, and then also Trileptal, potentially. Trileptal is a tricyclic medication. I'm trying to think and search back into my memory, but I definitely was taking Neurontin, Zyprexa, and Depakote. So I was taking those, and I started having very weird side effects. So I played soccer my sophomore year in high school, and I scored 25 goals. And then my junior year, I scored 0 goals. And definitely one of the reasons for this was when I was taking this medication combination, I was experiencing a substantial lack of coordination. I'll leave it at that. I could definitely tell it was extremely palatable, and it was very noticeable that my coordination when I was playing sports was significantly decreased and disabled relative to what it was just a year prior when I was off the medication. Now, one can argue that the depression that I was experiencing could also lead to decreased coordination, and that's potentially pliable. I'm not saying that there's a causation between the medication and the decrease in coordination. Do I believe that there's a significant causation between the medication I was taking and the lack of coordination? I do, but I can't prove that. It's possible that it's just simply a correlation. So, in any case, I then went to Cornell. I was seeing about 4 or 5 doctors by this time. So when I was 18 years old, I was taking medication at Cornell. My sophomore My freshman year at Cornell was very bad, where I was experiencing a lot of depression and OCD issues. The OCD was like I would constantly check things. I would check in the garbage. I would constantly have to carry around lists. I would have a lot of mental list making. I would like check my browsers, check my email, the trash folder, and everything like that. Sophomore year, my psychiatrist was able to get me stabilized. I was taking at this time around 30 milligrams of Paxil and around 50 milligrams of Anafranil, and that seemed to be like the golden or the best treatment for me in order to stabilize me. And I felt really good. I felt just like I did prior to 15 years old when I was afflicted with the depression and the OCD. So I felt completely normal. Then at Cornell, my sophomore year, I actually made nationals in public speaking. My verbal communication ability, my mental confluence, and my mental clarity returned completely, and I made nationals, like I said. And I also ended my sophomore year at Cornell with over a 4.0 GPA. My junior year at Cornell, I was experiencing a lot of symptoms. I couldn't remember things. I couldn't learn new information. The only reason why I made it through and had decent grades was because I took really easy classes. So I pretty much took classes that were incremental for the classes that I previously took, where I essentially knew like 80% of the information going into that new class because it just simply built on my prior classes. So I was able to do that and able to get good grades. I also took like business school classes, which they're very easy for undergrads. I mean, as you guys know, if you go to like a very prestigious school, it's incredibly hard to get into the undergraduate program at like Harvard or Yale or Princeton or any of the Ivy League schools, but getting into a graduate school program is actually relatively easy. It's much less competitive than it is to get into the undergraduate program because you're pulling from a much wider array of kids for the undergraduate program. So generally, even if you're an undergrad, if you take graduate level programs, the quality of the competition at those programs are a lot lower. And I'm sorry, I'm not trying to like diss any graduate programs. I'm just telling you that from my personal experience, when I took graduate level programs at Cornell, they were substantially easier than my undergraduate programs. So I did things like that, like I would hack my schedule, so I got decent grades. But in my junior year of college, I was struggling. I was able to secure an internship at Morgan Stanley, and I did okay during my internship. But when I graduated early from Cornell, and I left school early, and when I was interviewing, I was very hampered because I couldn't speak. I couldn't speak clearly, I couldn't think clearly, and I wasn't presenting myself in a good manner, and I just simply wasn't receiving offers. So I want to go through some of the medication that I tried in order to bring myself back to homeostasis and bring myself stable again. I tried Paxil, Anafranil, Abilify, Adderall, Memantine, Azilect. I injected testosterone. I think it was testosterone enanthate. I tried Geodon, which is an antipsychotic or an anticonvulsant. I tried Zyprexa, Trileptal, which I believe is a tricyclic drug. I tried Depakote, Neurontin, Luvox, Lithium, and Wellbutrin. I pretty much tried around 20 medications. I've also tried, as I mentioned before, at Columbia University, I've been enrolled in numerous studies, government-funded studies that included cognitive behavioral therapy, repetitive transcranial magnetic stimulation, intravenous ketamine, and I can tell you that I don't trust doctors, even though my father's a doctor and my uncle is a doctor as well. I believe that doctors, they don't have the necessary knowledge, and they are disabled by their own knowledge, where they're unable to prescribe you things that would actually help you, because they are prescribing you medications that are simply being provided and produced by the psychiatric, or rather by the pharmaceutical industry, and those drugs that are provided to them by the pharmaceutical industry do not work. So I know it's a little bit controversial. I think that doctors have, for the most part, they have their patient's best interest at heart, even though a lot of them have been arrested recently for overprescribing opioids. So they're using that as like an opioid mill, where they're cashing in to essentially turn their prescriptions into a cash cow. But for the most part, remember, not everyone is always 100% good. I think that 90% of doctors legitimately try to help their patients, and 10% don't. But realistically, doctors are hamstrung and they're limited significantly, they're handcuffed by the pharmaceutical industry, which has no ability or no desire to actually cure your illness. Instead, the pharmaceutical industry, their desire is to manage your illness for you. So the reason I don't trust doctors is that you essentially give up your power. And remember that nobody cares about your own health and well-being more than you do. So you should definitely take control over your own health by doing things like eating right, and there are a lot of supplements that you can take. I'm going to go into that in a future video, but I can tell you that I am proof where just about 10 years ago, and I've been dealing with mental illness since I was about 15 years old, with depression, significant OCD, and other things which completely 100% disabled me. And I took over 20 medications. I was enrolled in 4 or 5 studies at Columbia University, and I can tell you some of the things that helped me improve my life. Remember that the pharmaceutical industry is incentivized to manage your illness. They have no incentive to actually help you cure. Also, your doctors usually prescribe 3 or 4 medications at one time. This is called combination drug therapy, but realize that there is no studies that have been tested which specifically indicate that combination drug therapy works. So for example, if you go to your doctor and they prescribe you Paxil and Nafranil, or Zyprexa and Lithium, or any 2 medications at once, you should specifically ask them for a scientific study that indicates that this combination drug therapy is actually effective and efficacious, because there isn't any. What the doctors do is they simply are incentivized, or they get comfortable prescribing 4 or 5 medications, and then they prescribe all of these medications to all of their patients. So you have to be very careful about that stuff. I also believe that a lot of the research that's done with the drug trials are flawed and biased, because remember, the pharmaceutical industry spends billions of dollars in order to get FDA approval. So, I mean, you guys can think what you want. If you want to go to your doctor and you want to pop pills, that's completely cool. I've done all of that for you. So I'm just making this video as a public service announcement, which to share with you my experiences where I've taken 20 or so medications, including anti-Alzheimer's disease drugs, anti-Parkinson's, a lot of drugs which are on the cutting edge of what they do, like memantine, Azilect, selegiline. I've taken all of those things which are contraindicated, or they actually have been shown to be slightly efficacious for depression and OCD. As I mentioned, I also had intravenous ketamine. I'm going to have to go soon because my child is screaming, and I want to make sure that I adhere and that I address his issues. So I only have about 2 more minutes. I have tried about 20 medications, so I know that I'm not a doctor, but you should ask your doctors specifically what medications they have tried, because I have tried 20 medications and virtually none of them have worked. The other thing is that some of the things that potentially triggered my mental illness was that my father was psychologically abusive. Also, I put myself in very high stressful environments by going to Cornell, by working on Wall Street as an investment banker. So I really didn't do myself any favors by placing myself intentionally in stressful situations by working on Wall Street as an investment banker and going to an Ivy League university. But I wanted to share with you these experiences that I suffered with, because I do believe that there's a better way that you can cure, and you can, or you maybe not cure, but there are things that you can do. So forget that cure word that I said, because I know that could potentially get me into trouble. But there are things that you can do that can help your illnesses, and I'm going to share with you the things that I did to help some of my symptoms. Now, this is not a cure. When I still struggle significantly from OCD, I still have some depression, but I want to share you some of the things that I did which enabled me to go from being unable to get up out of bed in 2009 to now being more functional. So I'll make more videos about that, and if you have any questions, you can leave a comment below, and I'd be happy to respond to any comments, and I'm here to help you. Thank you.